What really is sickle cell, and why is it important that you and your partner, before you get married, should actually get tested for it? To basically understand it, we need to know what a red blood cell is. Now, your blood has got two parts. It has the fluid part and the cell part. Now, majority of that cell part are your red blood cells, and the function of these red blood cells is to carry oxygen around your body, and they are the ones that give you that red color. A normal red blood cell should look like this. We basically call this shape as biconcave. This shape specifically is very, very adaptive. So it passes through very tiny spaces without causing problems. You should know that you've got big vessels and you have smaller vessels, but these cells manage to pass through those same very, very small tiny vessels, mainly because they are hydrophilic. Now, hydrophilic just simply means they love water. Simply that. A sickle cell patient is going to have this shape of the red blood cell. So it changes from this to this. This shape usually comes about when there's a stress factor that's in play. Let's say, for instance, you get dehydrated for so much. Let's say you have an infection. Anything that's going to be stressful is going to change your shape of the red blood cell from this one to this other one when you have sickle cell. Now, this sickle cell shape finds it very difficult to navigate very small and tiny spaces, which leads to them being stuck in places where they're not supposed to. So why does this actually happen? Why is it that certain people have sickle cell and some people don't? Well, we have to go a little bit back to the basics. You know, the red blood cell that we talked about is made up of hemoglobin. The hemoglobin is the one that is making the red blood cell red, and then your red blood cell is making your blood red. I hope you get the point. Now, this hemoglobin, like the name suggests, is made up of heme and globin. The heme part for now is just iron, and we'll forget about it. But the globin is made up of proteins. Now, I want you to know that every protein is made up of other tiny components, and these are called amino acids. Now, these things have a very unique way in which that they align themselves. What I mean is that if you have a layer that's like, let's say, 1 to about 10, or let's say for simplicity's sake, you have A, B, C, D. When A, B, C, D are arranged in that particular order, they form one thing. Let's just say black. But if you come to change this arrangement, instead of A, B, C, D, you come and put it as A, C, B, D. The thing that you're going to form will no longer be black, even though you have the same letters but a different arrangement. The point I'm trying to make is that when your amino acids are forming a protein, they are supposed to be arranged in a particular order. And if anything changes in between them, whichever way, it changes the whole picture of whatever you're making. So in this case, your globin, this protein, the one that is making your red blood cell, in normal people, at the position 6, so it has a lot of them, a lot of amino acids, but at the position 6, you have normally an amino acid we call glutamate, and this glutamate loves water. And no wonder the overall shape of a normal red blood cell is that it will love water and it can easily pass through places. Now, the problem in sickle cell is that at that position 6, this glutamate is replaced by something else, which we call valine, also an amino acid. Now, valine is hydrophobic. It doesn't love water, and that's the main reason why it will find it difficult to navigate in places which are very difficult to go through. And this is where the problem of sickle cell comes in. Imagine when you block blood from going to a particular place, certain changes start to happen, and one of the first changes you will see is going to be pain. Now, the typical age at which we diagnose sickle cell is going to be anywhere between 3 to 6 months and above. Mainly in children, you're going to notice them having swollen fingers or toes. And this shows that blood has been blocked from reaching where it's supposed to go, and then you're having this swelling, and this is going to be causing pain. In boys, you can actually notice that their penis will become erect, and this erection is not going away. This is a very serious complication that should be dealt with immediately. Another problem that comes about because of that shape of the red blood cell is that you have an organ in your body called the spleen. The spleen's job is to remove every cell that is defective in your body. It will pick these red blood cells which are not looking normal. They have this sickle cell shape, so it will keep breaking them down. A normal red blood cell has a lifespan of about 120 days. And because these sickle cell shaped cells are being picked as being abnormal, of which they are, they're going to be cut down and destroyed more quickly than normal red blood cells. Therefore, they have a lifespan of about 10 to 20 days. And remember, when you're reducing the number of red blood cells, you are causing anemia. So your blood level is going down. This is why a person who has sickle cell anemia will have a low blood level for the entire period, and in fact for the rest of their lives. Okay, now that we know where sickle cell comes from and some of the problems it can bring, we need to ask ourselves, how does sickle cell move from the parents to the children? Well, this is just a simple thing that you should know, that everything that you have in your body was a combination of your mother and your dad. Everyone contributed half each, and that's how they made you as a whole human being. For sickle cell, the red blood cell itself has something from your mom and something from your dad. Now, these things that are being contributed here are mainly two things. We call them dominant and recessive. Think of dominant as just literally someone who's dominant, who talks a lot, like an extrovert. So wherever they are going to be felt, like you will feel their presence. However, for the introverts, the one that we call is recessive, is usually very mute, doesn't talk much, and as long as this person who's dominant is around, the dominant one is one that's going to be felt as if they're the only ones around, and then the recessive one is going to be literally like they're not there. Now, this is important in sickle cell because what is being donated from each and every parent, both of them should be introverts. Whenever one contributes something that is normal, which is a dominant one, you will not have sickle cell disease. So to simplify this, we're going to use some simple letters. Capital letter A in this discussion is going to indicate a normal hemoglobin that is coming from one parent. And then the small letter S is going to indicate a sickle cell hemoglobin coming from the other parent. Now, the capital letter A is dominant, which is why I've put it in capital. So this one expresses itself very much. And then the small letter S is recessive. Now, here's a typical example. When you're a parent, you have normal hemoglobin. So meaning you've got two letter A's, one that came from your mother and one came from your dad. Then you have your wife who's having A and letter A, meaning both of them are normal as well, isn't it? From both parents. When these two people come to have children, whatever combination that will make from these two, as we can see here, are going to make all of their children who are going to be A throughout. So here you will know that there will be no sickle cell child that's going to be present. Then who gets to be a carrier? So this is a person who got the capital letter A from their mother and the small letter S from their father, and then they have it. This person is the one who's called a carrier. They're a carrier because they don't have sickle cell, but they can pass it on to someone else. Then that person can have sickle cell. And this is where things get interesting. Imagine if two carriers came together. They are not sickle cell patients. They don't even know anything. They live very much normal lives. And then they come together. They have a probability of having a sickle cell child by 25%. And this is just a simple table that I'm going to show you that shows that. So imagine the father gives a small letter S that he has, and then the mother too contributes a small letter S that she has, making a child with two small letter S's. So remember, now both of them are introverts. Even though you're introverts, when you found yourself, at least you will be made to talk to each other. So this is the only time when they get to express themselves. In medical terms, we call this as autosomal recessive. And this is the only time when you see this sickle cell express itself. This is the main reason why we say you need to check yourself even though you feel very much normal. Yes, I agree that certain carriers under certain extreme conditions can develop symptoms as though they are a sickle cell person. But in many cases, these people live very much normal lives. A simple test that we do is HB electrophoresis. This is going to tell you whether you're a carrier, a sickler, a normal person, and this helps you to prepare yourself in an event that you have a sickle cell child. Sickle cell children are not easy children to keep because they are very demanding. But if you are ready for them and you know what's coming, these are people who live very long lives and they live very comfortable lives. I personally have seen a 50-year-old woman who's a sickler and she's lived a very comfortable life. Of course, with few times that are very difficult on her end. So remember, sickle cell is something genetic. You're not going to do anything about it. Our good friends have found certain levels of treatment called a stem cell transplant. In our setting, we do not have that. So all that we have is preparing and managing the symptoms as we see them come.